We know quite a bit about contemporary hospital-level use of early catheterization in patients presenting with STEMI, but a lot less about patients with NSTEMI. So we are here to talk about one of 24 NCDR analyses presented here at ACC 16. And to do this, I'm with Dr. Carolyn Hansen, MD, Post-Doctoral Research Scholar at Duke Clinical Research Institute at Duke University. First, thank you very much. Now, specifically, this is insights from the NCDR Action Registry and Get with the Guidelines. Correct?
Correct.
Okay, so why did you do this analysis? What drove you to this particular topic?
Well, current guidelines advocate for early invasive management of non-STEMI patients, but we actually know very little about current patterns of angiography for non-STEMI patients in the United States.
So what did you find?
Well, we actually found something very interesting. We found first that about 60% of all non-STEMI patients received angiography within 24 hours of admission. However, we saw a wide variation among hospitals for which patients were receiving angiography within 24 hours, particularly patients with a high risk patients, non-STEMI patients. There was a very large variation among hospitals.
I think it was like 30% to 100%?
That's right.
You can't get much broader than that.
No, that's right. So, yeah, the range was from 30 to 100%. The median was about 60. And we saw that among all patients, 60% received angiography within 24 hours. However, of the high-risk patients, which are those who are eligible for angiography within 24 hours, 40% actually did not receive timely angiography.
Now, in terms of case mix, is that explaining any of this? I'm sure you must have looked at that.
Yeah, we did look at patient characteristics across tertiles of hospitals, and there was a little bit of a difference. Overall, patient characteristics were similar across tertiles. However, we did see that patients in the highest tertile of angiography within 24 hours tended to be male, tended to be white, and tended to have more cardiac arrest or cardiogenic shock, a little bit, slightly more. They, however, seemed to have less comorbidity prior to admission, so patients were less likely to have prior heart failure or diabetes prior to admission with non-STEMI.
Given the consistent inconsistency that you revealed, what does this tell us?
Well, I'd like to add that we also looked at hospital characteristics across these tertiles, which adds another layer of, so one thing is which patients are we looking at, but also which hospitals are actually treating these patients within the given time frame. So in the hospitals in the highest tertile for angiography within 24 hours, interestingly, were less likely to be academic centers, were more likely to have lower non-STEMI annual volumes, and we're more likely to have higher defect-free care scores. So, yeah, very interesting.
Yeah.
Actually, you know, it was surprising to see that they were less likely to be academic and more likely to have lower volumes. However, the finding that they were more likely to have a higher defect-free care score, which is composite performance measure. So a defect-free care score of 100 is a perfect care for a non-STEMI patient. So we see that hospitals that have higher scores were actually more likely to treat these patients within 24 hours. Makes sense, right?
Yeah.
So in conclusion, what we saw from this data among these non-STEMI patients invasively managed within 72 hours were there was a wide hospital variation. There were some case mix differences. However, we did not feel or we do not think they could fully explain the enormous variability. And finally, that institutional commitment to adhere to patient guidelines may actually play a greater role in choosing patients for angiography within 24 hours than patient characteristics per se.
So after this, are you at least optimistic that maybe things will even out a little bit?
Yeah, I think so. I think as we get more used to using guidelines as guidance for for patient treatment. And as we are more aware of these differences, I hope this study will help clinicians stick more to the guidelines. Yeah.
Well, congratulations. This is one of, like I said, 24 NCDR publications from this meeting. And to read all about them, please make sure you check out CardioSource World News and CardioSource World News Interventions, where I'm Executive Editor Rick McGuire.